Before you dismiss that tingling, numbness, or strange sensation in your feet as simply getting older, take just 30 seconds to look a little closer. Your feet could be sending you one of the earliest warnings of hidden diabetes years before you ever receive a diagnosis. Many older adults feel perfectly healthy while silent damage is already affecting their blood vessels and nerves. The surprising part is that your feet often notice the problem long before you do. A tiny change in sensation, a cut that refuses to heal, or skin that looks slightly different may seem harmless, but together they can reveal a much bigger story. In today's video, we'll uncover 9 warning signs your feet may be giving you after age 60 that could point to undiagnosed diabetes. More importantly, you'll learn why these signs appear, what they mean, and when it's time to speak with your doctor. One of these warning signs is so commonly ignored that thousands of people don't recognize it until serious complications develop. Stay with us until the end. You may discover a clue that could help protect your health for years to come. Most people think diabetes begins with high blood sugar, but that's only part of the story. In reality, diabetes slowly damages the body's smallest blood vessels, and some of the first places to show the effects are your feet. They sit farther from the heart than almost any other part of your body, making them especially vulnerable when circulation begins to decline. At the same time, elevated blood sugar can gradually injure the nerves that allow you to feel temperature, pressure, and pain. That's why seemingly minor changes such as tingling, numbness, burning sensations, or slow healing cuts may appear long before you ever feel sick. Unfortunately, many older adults dismiss these changes as a normal part of aging and never mention them to their doctor. But your feet are often acting as an early warning system, giving you valuable time to detect diabetes before serious complications develop. Paying attention to these subtle signals today could help protect your nerves, kidneys, heart, eyesight, and overall quality of life in the years ahead. One of the earliest and most common warning signs of diabetes is a strange feeling in your feet. It may begin as mild tingling, occasional numbness, or a burning sensation that comes and goes. Some people describe it as tiny pins and needles, while others feel as though their socks are bunched up even when they're barefoot. These symptoms often become more noticeable at night, making it difficult to relax or sleep. This happens because persistently elevated blood sugar can gradually damage the tiny nerves in your feet, a condition known as peripheral neuropathy. As those nerves become less healthy, they struggle to send normal signals to your brain. Over time, you may lose the ability to feel pain, heat, or even a small injury. That can be dangerous because a cut, blister, or pebble inside your shoe may go unnoticed and worsen before you realize there's a problem. Although tingling feet do not always mean diabetes, they should never be ignored, especially after age 60. If these sensations continue for several weeks or become more frequent, it's wise to discuss them with your healthcare provider and consider checking your blood sugar. The earlier diabetes is identified, the better the chance of slowing nerve damage through healthy eating, regular physical activity, proper foot care, and good glucose management. Listening to your feet today could help you avoid much more serious complications in the future. Another warning sign that deserves immediate attention is a wound on your foot that refuses to heal or skin that suddenly changes color. A small blister, scratch, or cut may not seem serious at first, but if it remains open for weeks instead of days, your body could be struggling to repair itself. High blood sugar can damage tiny blood vessels, reducing the amount of oxygen and nutrients that reach the skin. Without an adequate blood supply, even minor injuries heal much more slowly and become more vulnerable to infection. You may also notice patches of skin that appear darker, reddish, purple, or unusually pale compared with the surrounding area. These color changes can be another clue that circulation is no longer as healthy as it should be. Because diabetes may also reduce feeling in the feet, some people don't even realize they have an injury until it becomes swollen or infected. That's why healthcare professionals encourage older adults to inspect their feet every day, including the soles and between the toes. If you discover a wound that isn't improving after a week or two, or you notice increasing redness, drainage, swelling, or a persistent change in skin color, don't wait for it to become painful. Seek medical advice as soon as possible. Early treatment can prevent a small problem from developing into a serious foot ulcer or a severe infection. Paying close attention to these subtle changes is one of the simplest ways to detect possible diabetes early and protect your mobility, independence, and overall health for years to come. Dry. Cracked heels may seem like nothing more than a cosmetic problem, especially as we age. But when deep cracks keep returning despite using moisturizer, they may deserve a closer look. Persistently high blood sugar can damage the nerves that control sweat glands in your feet. As a result, your skin produces less natural moisture, becoming dry, rough, and more likely to split. These cracks can become painful and create openings where bacteria and fungi can enter, increasing the risk of infection. If diabetes is also reducing blood flow, those small cracks may take much longer to heal than expected. While not every case of cracked heels is caused by diabetes, persistent heel fissures combined with numbness, tingling, or slow-healing wounds should not be ignored. Keep your feet clean, moisturize them daily, wear properly fitted shoes, and inspect your heels regularly for new cracks. If the skin continues to worsen or shows signs of redness, swelling, or drainage, consult your healthcare provider. Sometimes your heels are telling you much more than simply, your skin is dry. Swelling in your feet or ankles is another sign that should never be dismissed as simply getting older. If your shoes suddenly feel tighter by the end of the day, or you notice sock marks that remain long after you've taken them off, your body may be retaining excess fluid. While swelling can have many causes, diabetes is one possible reason, especially when it has already begun affecting the kidneys or circulation. Over time, high blood sugar can damage the tiny blood vessels that help the kidneys remove excess fluid from the body. When the kidneys become less efficient, fluid may collect in the feet and ankles, causing persistent swelling. Poor circulation can also contribute to this problem. One simple way to check is to gently press your finger into the swollen area for a few seconds. If a small dent remains after you lift your finger, this is called pitting edema and should be discussed with your healthcare provider. Don't assume that swelling is harmless, particularly if it appears along with numbness, slow-healing wounds, or changes in skin color. To help reduce mild swelling, try limiting excess sodium, staying physically active, avoiding long periods of sitting, and elevating your legs when resting. However, if the swelling develops suddenly, becomes severe, or is accompanied by shortness of breath or chest pain, seek medical attention immediately. Your feet may be revealing important information about your circulation, kidney health, and blood sugar long before other symptoms become obvious. Sharp, stabbing pain, or sudden electric shock-like sensations in your feet are not a normal part of aging. Many people describe the feeling as brief jolts, burning flashes, or painful stabs that appear without warning, especially while resting or trying to sleep. These symptoms are often linked to diabetic peripheral neuropathy, a condition caused by prolonged exposure to high blood sugar that gradually injures the nerves. As the nerves become damaged, they may send abnormal pain signals even when there is no injury. Ironically, some people experience severe pain, while others lose sensation completely in the same area. If these painful episodes occur repeatedly, don't ignore them or simply rely on over-the-counter pain medications. Frequent use of certain NSAID pain relievers may not be appropriate for everyone, particularly people with kidney disease or other medical conditions. Instead, discuss your symptoms with your healthcare provider, who can evaluate whether diabetes or another nerve disorder may be the cause. Managing blood sugar, staying physically active, and caring for your feet every day can help slow the progression of nerve damage. Acting early may reduce discomfort and help preserve healthy nerve function for years to come. If your feet always feel cold, even when the room is warm or you're wearing thick socks, don't assume it's simply a sign of aging. Persistently cold feet can sometimes indicate reduced blood flow, a condition that becomes more common in people with diabetes. Over time, high blood sugar can damage the arteries, making it harder for oxygen-rich blood to reach the feet. This condition, known as peripheral artery disease, may develop slowly and often goes unnoticed until symptoms become more obvious. Along with feeling cold, your feet may appear pale, your pulses may feel weaker, or you may experience leg pain while walking that improves with rest. Because healthy circulation is essential for healing and nerve function, poor blood flow can increase the risk of ulcers and infections. Staying physically active, avoiding smoking, controlling blood sugar, blood pressure, and cholesterol can all help support healthier circulation. If one or both feet remain unusually cold or the symptom is getting worse, it's important to discuss it with your healthcare provider. Your feet may be revealing that your circulation needs attention before more serious complications develop. One warning sign that many people overlook is the gradual loss of hair on the lower legs or the tops of the feet. While it may not seem important, reduced hair growth can sometimes be a clue that blood circulation is declining. Hair follicles rely on a steady supply of oxygen and nutrients delivered by healthy blood vessels. When diabetes damages those vessels over time, less blood reaches the skin, and hair may become thinner or disappear altogether. You might also notice that the skin looks smooth, shiny, or feels cooler than usual. Although hair loss on the legs can occur for several reasons, it becomes more concerning when it appears alongside cold feet, numbness, slow-healing wounds, or changes in skin color. These signs together may point to poor circulation related to diabetes or peripheral artery disease. If you notice these changes, don't simply assume they are a normal part of aging. Mention them during your next medical visit. Paying attention to subtle changes in your legs and feet can help identify circulation problems early, allowing treatment to begin before more serious complications develop. The good news is that you don't need special equipment to spot many early warning signs. Spend just 30 seconds each day checking your feet for cuts, blisters, swelling, changes in skin color, or areas of numbness. Use a mirror to see the soles if needed, or ask a family member for help. If you notice persistent symptoms, don't wait until they become painful. Schedule a visit with your healthcare provider and ask whether a fasting blood glucose or HbA1c test is appropriate. Detecting diabetes early can help prevent serious complications and protect your nerves, kidneys, heart, eyesight, and overall quality of life. Small daily checks can make a big difference over time. Your feet can reveal far more about your health than you might expect. Tingling, burning sensations, slow-healing wounds, cracked heels, swelling, sharp nerve pain, cold feet, or even the loss of hair on your lower legs should never be dismissed as simply getting older. While none of these signs alone confirms diabetes, they can serve as important early clues that deserve attention. The sooner diabetes is identified, the greater the opportunity to protect your nerves, blood vessels, kidneys, eyesight, and heart from long-term damage. By checking your feet regularly, maintaining a healthy lifestyle, and seeking medical advice when changes appear, you can take control before small problems become serious complications. Sometimes the smallest signals from your feet are your body's most valuable warning, and listening to them today may help protect your health for many years to come. Thank you for watching. Remember, your feet can reveal important clues about your health long before diabetes causes serious complications. A few moments spent checking your feet each day could help you notice changes early and start a conversation with your healthcare provider before small problems become much bigger ones. If you experienced any of the warning signs we discussed today, don't panic, but don't ignore them either. Early detection and healthy lifestyle changes can make a remarkable difference. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more evidence-based health tips designed especially for older adults. Also, share this video with a friend or family member over 60. It might help someone recognize an important warning sign they would have otherwise missed. Finally, we'd love to hear from you. Which symptom surprised you the most, or have you noticed any of these changes yourself? Leave a comment below, we read every one of them. Thanks for watching, stay healthy, and we'll see you in the next video.